What the is up? Jared Ween here and Tammy Francis Manskis, and we're here. Patient's something's wrong with the patient, so we gotta go. Come on.
It's called shock.
Hello, Blue Shrimp Company here.
Yes. Thanks. So what's going on?
What's going on? What's your name? You got a name? Are you okay? Are you okay? Are you okay? Something's wrong with him.
But yeah, you didn't do the knife hands to ask me if he's okay.
Are you okay? Are you okay? Something's wrong with him.
Well, let's get him on the ground. Okay.
Okay, our patient is Our patient is presenting with hypovolemia, which means hypotension, which means that they have a decreased blood pressure. They also
But he's not awake, he's not alert.
No.
Is he breathing?
I don't know, is he? I think he has a broken spine. Maybe that's how this started.
He is breathing. He's breathing.
He is breathing.
Okay, so get God, what is wrong with you?
You know who you're talking to?
Yeah.
I'm Jared Ween. I'm the wiener. The
Hello
wiener.
and welcome, Olivia. So glad you're joining us today. My name is Dr. Dan.Peterson. I'm the EMS director here at Blue Shrimp EMS. And today we're going to be doing a training for everybody. We're doing a training on Neurogenic Shock today. And I really hope you learn as much as everyone else. Me and my fellow superiors, because I'm a doctor, of course. Just thought I had to mention that. We realized that we just might need to do a little bit of pick me up on some things. So all the providers and you today graciously decided to help us research and talk about this neurogenic shock, this condition. So yeah, I think we're ready to get started. Let's go.
What's up? Jared Ween here, #1 firefighter at Blue Shrimp Ambulance, whatever we are here. Doing what are we doing today? Shit. Sorry. Doing what are we doing? A refresher, whatever, on neurogenic shock, or I don't know. Oh shit. Shit. You guys didn't see that. We call that on the job life insurance. Anyway, today we're talking neurogenic shock. Reminder, refresher. Olivia, you're new blood, right? You meet Dr. Perth yet? Dr. Perth, shrimp on the bobby. He claims he's Australian. We don't know what he has. Claims he's Australianism. You're gonna meet Tammy too. She's she's something. But yeah, I guess we're just gonna go over like treatments and whatever.
Hi,
whatever.
I'm Tammy. I don't really know why I'm here. I mean, you work here for 12 years, show up every day and accidentally kill someone one time, and all of a sudden I'm the bad guy. I don't know who you've all met. I know that you're a student working with us or something. I know that there's a doctor, he's Australian, kind of cool. Then there's that Derek or Jared or something, he's kind of a tool, a little bit of a slut. I don't know, it's a bit dramatic, don't you think?
Hey everyone, I'm Olivia, and I'm super excited to be here. And I've heard so much about this place. I've been in the paramedic program for about 2 months now, and I'm learning so much. So, super excited to be here and learn everything about everyone. So,
What up, everybody? Dr. Dan.Peterson, and today we're getting started with our presentation, our training on neurogenic shock. All right, we got a little bit going from everybody today. Okay, let's get going right away. Agenda. All right. We have a list of things we want to do. Okay. First, introduction by me, Dr. Dan.Peterson. And then next we got what is neurogenic shock by Tammy Francis. All right. After that, pathophys by our student, Olivia Garcia. All right. Then we got signs and symptoms by Dr. Dan Perth again, doctor. And then after that, treatments by Jade Weiner. And then finally, conclusion by Jade. Okay? We're all going good? Amy? Awesome. Next slide. Alright, let's get started. Introduction, okay? Shock kills more than you think, alright? Neurogenic shock doesn't happen that often, not super common, alright? But might affect you more than you think, alright? It's difficult to stop. All shock is difficult to stop, alright? That's just how it is. Once the dominoes get rolling, and then it's important to educate everybody, providers, and keep up on training, okay? So we're able to detect this kind of stuff so that we don't miss it and we can help our patients, alright? And then an interesting factoid actually is, according to the National Library of Medicine, approximately 8,000 to 10,000 individuals experience traumatic spinal cord injuries in the US, all right? And if I remember correctly, I believe out of about 500 cases, almost about 20% of those was neurogenic shock, all right? So statistically, it happens. And then what should we know about neurogenic shock exactly? Well, what it is. We need to know what it is, how it differentiates from the other kinds of shock, all right? And then the anatomy and physiology of it. That's really important, I think. I think everyone else agrees with that. And signs and symptoms, all right? And then finally, treatments. What can we do for the patient, all right?
Okay, what's up guys? I'm paramedic Tammy here. I'm gonna be explaining what is neurogenic shock. Neurogenic shock is a form of distributive shock. It causes vasodilation, so that means that every blood vessel expands and dilates. That causes the blood pressure, pulse, body temperature, everything to be out of sorts and really hard to regulate. So that means that it's very hard to get into the brain, kidneys, and like body extremities. Can't regulate the body temperature. They'll feel warm, but they're at risk of hypothermia. It's caused by damage to the spinal cord, any other vertebrae, lacerations to the spinal cord. And by damage to the spinal cord, what I mean is any damage from C1 to C5 is at very high risk for neurogenic shock. Granted, it's also interchangeable with spine shock, but neurogenic for this demonstration here. So anything above T6, well, from T6 and up can also have high risk, but it's mainly in this area, which is up in your cervical. And then obviously after this goes to the brain. Threw in some nice pictures for you. And then, yeah, so any of these that get lacerated anywhere from here, you're at very high risk. Just don't get into a wreck.
I'm Olivia, and I did the pathophysiology of neurogenic shock. So that means when the sympathetic nervous system is disrupted, it leads to hypotension, bradycardia, poor circulation, which causes blood to pool in the extremities and reduces venous return to the heart. It is the only type of shock that involves bradycardia compared to the other ones, which involve tachycardia, and that's due to the sudden loss of sympathetic nervous system signals. Because of the bradycardia, the body's in a relaxed state, with the fight or flight system is suppressed or damaged. So when the nervous system is damaged, it stops the production of epinephrine and norepinephrine needed to keep the blood pressure stable. And then inflammation triggers the body cells to release cytokines, and by doing so, it makes the blood vessels leak more and fluid escapes, and it lowers the blood pressure even more. And sympathetic nervous system, it loses the ability to regulate the cardiovascular system, which in turn causes vasodilation and decreased perfusion to cells, and it leads to cellular tissue hypoxia.
So you want to know why I love EMS? Well, first off, I'm a doctor. Make that clear. I did doctorate, 8 years. Thought I'd point that out. And I'm an EMS director. The truth is, I just love EMS because I love helping people and stopping other people from doing dumb shit. Like Tammy and Jared. I feel like I'm their father at work, actually, but that's besides the point. Why do I love EMS? I don't know. Why do I? That's a good question. All right.
Why am I still in love with Tammy? Oh, you're gonna ask, what do I love about EMS? Well, I love firefighting because chicks dig it. I get to break stuff. Put water on stuff. Chicks dig it. I think Tammy dug it about 10 years ago. Do you want to see my wiener tattoo? This is the wiener right here. I'll show you after. I don't know. Dr. Perth will say some BS about, helping people, blah, blah, blah. The insurance is great. We have great insurance here. I mean, that's about it.
What was the question? Why do I love EMS? Probably, well, I've been doing this for about 12 years. Yeah, 12. And then about 10 years ago was the worst time of my life. The pay is not great, but I gotta pay for, my 7 kids because my 8 baby daddies just don't pay anything at all, especially the one, Actually, I think you might have met him. I won't say names though, because that's a bit dramatic.
Alright, so it's Olivia again. Yes, what do I love about EMS? Well, you get to poke people and all of the other cool procedures that you get to do. As well as this department. It's pretty interesting, got some crazy people like Jared and Tammy with their backstory and all that stuff. Doctor's pretty interesting, and yeah, very excited to work here.
Dr. Dan Perth back here, all right? And now we're doing signs and symptoms, most important, like me, if you ask me. Anyway, doctor, by the way. All right, so neurogenic shock, it's unique and unpredictable, all right? It can be fatal if providers don't see it right away, okay? There's things you gotta think about, all right? The patient will almost always experience some kind of head, neck, or back pain, all right? Because this comes from trauma, all right? Neurogenic shock normally comes from trauma, okay? And so some of the things that providers will see right away, things that you should notice right away, warm and flushed skin, all right? Can anyone tell me why? I'm gonna tell you why anyway, all right? Because vasodilated, all right? Your sympathetic nervous system is shot, it's gone. That's what signifies neurogenic shock, all right? Your sympathetic system is down, so you're not getting that vasculature in your body is gone, all right? So the blood's starting to pool. That's why you get that warm and flushed skin, all right? There's not a lot of circulation going on. Altered mental status, this could come because the blood's not circulating, right? You're not getting that perfusion. It can become confused or dizzy. And this is more of extreme cases, like depending on where they get injured, but you could get impaired reflexes, loss of feeling in their extremities, all right? And maybe possibly inability to sweat, which is funny because that would counter indicate warm and flushed skin, right? And then we go to more of the extreme signs and symptoms, all right? Things that vitals will tell us that you should see after checking the patient, all right? Hypotension with an extremely low diastolic, all right? You know why? Because the perfusion's not happening. There's no perfusion in the body. Not that there's no perfusion, but it's not happening very well because the low diastolic. We don't have that sympathetic nervous system to boost our blood pressure, all right? And then because of that, we gotta make sure that we're monitoring mean arterial pressure and the cardiac output, all right? That will being able to monitor that, we can tell like how far in shock they are, how much they're struggling, right? And then, as we might have caught on before, bradycardia is one of the few and only types of shock where this will present right away, all right? Because because the sympathetic nervous system is down, it's not working, okay? So we're not getting that increased heart rate that we would with all the other types of shock, okay? And then once we get further into the call, there's some other things you should be looking at, okay? Decreased oximetry, all right? Are they getting oxygen to the extremities, all right? That's important. Are they perfusing? That's what we need to keep track of. And then obviously decreased end tidal, I'm sorry, that's a typo actually. Increase end tidal. If it's really high, we're not getting that work we should from our lungs, all right? That's something to keep track of, all right? Awesome.
What the is up? Jared Ween, the Wiener, back at it again. Gonna talk to you guys a little bit about treatment of neurogenic shock. First of all, I should probably address something right away. Me and Tammy got into a little scuffle before this. So explain the draft look here, but it is relevant because we are going to talk about spinal immobilization. You think I look bad? You should see what she looks like, right? I shouldn't say that. I don't hit women. I love my mother. Okay. Okay. So the first step on scene for pre-hospital treatment of neurogenic shock should be, like I said, spinal immobilization. This is because of the mechanism of injury. Obviously, it was trauma. This really freaking hurts. So they obviously have trauma to their spine. If it's not their spine, which it most commonly is, it's going to be brainstem trauma, which will explain the C collar, or it's going to be neck or a high level head trauma. Either way, it's indicative that we got to immobilize this person immediately, because even if they don't have neurogenic shock yet and they just have a spinal injury, immobilizing them might prevent shock from even happening to begin with. So first step is we're gonna throw them on a backboard, throw a C-spine on them. Good, we're set. And then next, we're gonna go for airway, obviously. If they're not breathing, we're screwed, we gotta fix that. And if they are paralyzed or whatever from the spinal cord trauma, and their intercostals are paralyzed or abdomen's paralyzed, they're gonna be using their other accessory muscles to really try and make up for that breathing. And if they're really using those accessory muscles, they might hurt themselves even worse. And like I said, knock themselves into shock if they haven't already. So very important that we manage airway right away. But the big things we have to focus on after that is achieving something that's called hemodynamic stability, which is basically just a fancy word for saying everything needs to be back to how it was before. Everything needs to check out normally. So like blood pressure and circulatory and breathing and all of that. So as we said before, their blood pressure's tanked if they're in neurogenic shock. So how we fix that is basically just fluid. And usually this is gonna be intravenously with saline, and we're gonna pump fluid in. And I'm not gonna lie, I tried Googling this. I'm not really sure how the anatomy works. Basically, you pump fluid in, fluid goes into the heart, fluid's in the heart, fluid comes out of the heart, and then fluid goes around the body. So that raises blood pressure. And if that doesn't work, that is just a temporary band-aid. If that doesn't work, we can go ahead and hit him with epinephrine, because as you know, that is a vasoconstrictor. And the goal to raising blood pressure is restoring the vascular rigidity, because right now it's all floppy and gross. No one likes floppy and gross. So yeah, if the fluid doesn't work, hit him with the epi, get that vascular rigidity back. And then as far as the bradycardia goes, usually we're just gonna hit him with some atropine or another chronotropic. Yeah, we're gonna hit it with atropine. And then a big thing I should touch on for all this is, it's kind of a lot, immobilizing, checking airway, doing the IV, all that stuff. The biggest thing to remember is we gotta go for speed here. Not only our patients going into shock. They also had a severe spinal trauma, and we need to get moving fast because there's only so much we can do in the pre-hospital setting. So rapid transport is huge. You don't want to spend too much time on scene, obviously. They're probably going to have to go to a trauma center that hopefully specializes in some kind of spinal treatment. And yeah, that's pretty much it. So we want to, like I said, hemodynamic stability is basically just like your body's ecosystem when it comes to shock. You want to make sure blood pressure is where it should be. It's not tanking. You want to make sure the heart rate's sped up. You don't have that bradycardia. And you want to make sure they're breathing and they're not, going into secondary injuries by, using their accessory muscles and stuff like that. And like I said, mobilization is huge because of the mechanism of injury. So, yeah, that's it. All right, Jared Ween back again. In conclusion, what is neurogenic shock? Basically, it boils down to spinal cord trauma, shocks the sympathetic nervous system or damages it in the brain. And that ties into anatomy and physiology here. The sympathetic nervous system is essentially the body's gas pedal. So once we shock it or hit it with some trauma, it's gonna hit the brakes. So we, as paramedics, need to come in, be the gas pedal, bring it back, you know what I mean? Pump those fluids intravenously, pump those fluids, maintain C-spine. What else did I say? Epinephrine, atropine, be the gas pedal, and recognize the signs, man. You saw that scenario earlier, right? You saw it, where Mr. Bear, we had no idea what the hell was going on. Recognize the signs. Tanked blood pressure, bradycardia. What else do we say? Flush skin. Decreased mental status. Yeah. What else was there? The end tidal. Increased. Yep. So yeah, recognize the signs. Super important. If you recognize the signs, you know what to do. And then, like I said, just rapid transport. Get them to the hospital. There's only so much we can do in the pre-hospital setting. Yep. Do the C-spine. Make sure they are very, very immobilized because, like I said, mechanism of injury. I mean, they busted their spine. That's huge. We're gonna have to immobilize them anyway. We know that. They're going to a trauma center. Try and find a trauma center that has the capacity to deal with spinal. And yeah, just be the gas pedal.
Oh, why did I choose this department? Well, actually, it was one of the only places where I could get my visa because I'm from Australia. If you didn't know, I'm actually the fifth Hemsworth brother. I changed my name. Sounds more professional. And then I add a doctor to it. But I actually am a doctor, really. I went to the University of Blue Shrimp. That's where I got my doctorate degree. All right, don't worry about it. Anyway, yeah, that's why I chose this department. I could see now why they were doing that, but it's okay. We'll get better. It can't get worse, right? Right?
Why did I choose this department? Well, it was a central location for all my kids, all my baby daddies.
I knocked up Tammy 10 years ago.
It's the location is about 5 miles from my trailer, so when my car breaks down or has broken down, it's a quick and easy brisk walk to work. Right? Not that nice in the winter, but it's not that bad. I just smoke my Camel Crushes and do my walk.
Why did I choose this department? Well, I mean, we're like one big happy family here. I mean, when Tammy's car breaks down 5 miles away at her trailer, I give her a ride to work. Don't tell my fiance. Yeah, I mean, I love the town, Blue Shrimp. Town of Blue Shrimp. I love blue shrimp in general. At home, I have a big aquarium, hundreds of blue shrimp. Anytime we get any red shrimp, gone. Send me the shrimp camp. Not my blue shrimp, baby, no way.
All right, Dr. Perth here, Tammy, and
Jared Ween.
hell yeah. Anyway, so we're gonna do a little educational scenario for you, all right? So I'm a patient in neurogenic shock, alright? And you guys don't know that yet, but you just start doing everything you would normally, alright? Okay. Action.
Hello, Jared Ween here, Fire Department, Blue Shrimp. What's going on?
Ambulance department.
I flew out my car windshield.
Okay.
Ah!
So, do you have any pain anywhere?
My neck really hurts.
Okay. So we're gonna put this collar on you here.
Alright.
I'm gonna maintain.
Yeah, you wanna do something finally?
Ah!
Let the people at home see what's the real issue here. Olivia, it's this guy. All right, I'm now going to verbalize taking a blood pressure since we don't have a cuff here. I'm gonna verbalize taking O2 and his heart rate.
My blood pressure is 110/40. My pulse is 55, and my SpO2 is 93.
Okay, so should probably roll him first, and then we're gonna go
Well-
on and.
Do you have any pain in your legs?
Do you guys see any more? What are some other signs and symptoms you could see in
Cool.
a patient in neurogenic shock?
Well, he's gonna be warm.
Your back's cracked. And
Means
your-
the skin. The skin.
Don't talk to me like that. I'm the wiener. Yeah, she's right though. The skin.
I feel a little dizzy.
Oh, you do? Probably because you got ran over by a car. Mechanism of injury indicates spinal trauma. Look up for neurogenic shock.
That's why we C-spine him, and that's why we're gonna get him onto a board.
All right, ready? Yep.
On that side. Tuck these clips in. Can I help you? Okay.
All right, ready? Oh, am I rolling by myself here? All right, I got it. I'm firefighter, Jared Ween. Ready? 1, 2, 3.
Yeah, you got it, tough guy.
Yeah, you're fine.
I mean myself, it's alright.
All right.
So an
Now, while
action-
she straps him in, sorry, I'm talking. While she straps him in, I'm going to go ahead and I'm going to verbalize administering an IV here so we can take care of that hypotensivity. If that doesn't work, that doesn't take, I'm going to go ahead and give an EpiPen, right? I am. And then that's going to, don't look at me like that.
I can't stand you.
You and your stupid pink purse.
You and your
Everywhere you
stupid
go.
child support that you don't pay.
Oh, yeah, and you and your
10
8 baby daddies.
10 years. 10 years, no child support, none.
We work the same job. We
I-
make no money.
How are you gonna pay for them
What's
shades
going
and that
on?
Get
jacket?
along with this. Shit. What are you doing? What are you gonna do with that? Wait. Oh! Oh! What is in that? You got rocks? Whoa! Whoa! Whoa!
Your
Whoa.
gun.
How'd you get that?
I don't know, maybe don't leave it laying around.
Look at do something.
What's going on?
Maybe don't leave it laying around. Whoa. I'm
Whoa.
getting out of here.